Murphy from Pennsylvania.
Thank you, Mr. Chairman. Health centers are quality, low-cost medical homes for millions. But they're more than just doctors' offices. They're a place where a child sees a pediatrician, an adult gets a checkup from their internist, someone can see the dentist to receive mental health care or prenatal care. Together, medical professionals at health centers coordinate care and work as a team, saving nearly $25 billion each year, money that would otherwise be spent on caring for sicker patients at emergency rooms. That's the good news. But the sad news is there's a serious shortage of providers, and no matter how great the center, families can experience long delays because of the shortage. Health centers located in medically underserved urban or rural areas report a 27% shortage of dentists, a 26% shortage of OBGYNs, a 13% shortage of family physicians, and there are also shortages of psychiatrists and psychologists. The centers simply do not have enough money to hire additional staff required to cover the growing patient needs. But there's an answer. Part-time and semi-retired health professionals want to help out but are unable to volunteer because of federal barriers. Oddly enough, at federal free clinics, volunteer providers receive medical malpractice coverage via the Federal Tort Claims Act. On the other hand, doctors and professionals employed by health centers are covered by the Federal Tort Claims Act. But volunteers at health centers don't get that liability protection, which can cost the centers thousands of dollars, and in some cases well over $100,000 per year for these extra doctors. Clinics cannot afford that extra expense. The Government Accountability Office has found that medical liability insurance costs pose a significant barrier for many providers who otherwise would be eager to volunteer at health centers. The Family Health Care Accessibility Act fixes this disparity and opens the door for volunteer providers at clinics all over the country. I want to thank Chairman Pitts and Chairman Upton for holding this hearing, and my partner and friend of this legislation, Gene Green of Texas. I also want to thank Bob Mountjoy of Cornerstone Care in Washington and Greene counties for being here today to testify about the potential for this legislation to help millions of families. We have a chance to do something to expand care to millions of Americans with this act without raising the bills for families or taxpayers. This is an example of real bipartisan reform that helps people get the health care they need, when they need it, close to home, at an affordable cost. Isn't that what we all want in health care? Thank you, and I yield back.